Hello guys, welcome back to my channel. My channel name is Real Homeopathy. Please like, share and subscribe to my channel, and weekly I'll be uploading 2 videos on gynecology and its therapeutics, and today I'll be explaining about the puberty menorrhagia, and for mainly I'll be focusing on the therapeutics. So the therapeutics is very much essential, and this is all related to homeopathic medicine. So there are certain medicines which I'll be explaining today which are related to the therapeutics. So first one will be the iodine. I'll be explaining everything in brief. And the phosphorus, sabina, semicifuga, creosote, belladonna and platina. So these are the drugs, 7 drugs that I'll be explaining. So these are certain drugs, and there are even other drugs which are even helpful for the menorrhagia, which are rustox, sickle core, arsenic alb and hanaxomica. So these are basically just an example which I am giving you is. So the main remedies is iodine, phosphorus, sabina, semicifuga, creosote, belladonna and platina. So firstly, today we will be dealing about the iodine in detail. So this iodine is the menorrhagial, the cause of this in iodine, it is due to endocrinal dysfunction. In menorrhagia, the main cause of this iodine will be endocrine dysfunction. So this is well treated in this iodine remedy, especially when it is related to the thyroid gland. So if there is any related to the thyroid gland, then menorrhagia, so iodine is the best well treated remedy. So the synthesis of the thyroxine so is impaired in this patient. So there is something like disturbance in the thyroxine. So this iodine is well indicated. So here menses is irregular. Generally it is a uterine hemorrhage, and menorrhagia there is with enlarged and indurated uterus. So iodine may be thought of when hemorrhage is due to pathological condition of the uterus. So menses irregular, generally uterine bleeding. Nextly, coming to if the uterus is enlarged and it is indurated, then there is a menorrhagia. Then you can think of this iodine remedy. There is acute catarrh of endometrium. Hemorrhagia is due to pathological condition of uterus. There is acute catarrh of endometrium. So there is great weakness during menses. There is a wedge-like pain in the right uterine pain. Right ovaries, you'll have more pain. So there is wedge-like pain in right ovaries, and even there is acute catarrh of endometrium. So these are the main points of your iodine. So considering the next point, hemorrhage occurring at every stool with cutting pain in the abdomen, and there is a blood after every stool, especially with cutting pain in abdomen. So blood after every stool where there is a cutting type of pain in the abdomen, so this is indicated. And also there is a pain in the leons and also in the small of back. Pain in leons and smaller back. Patient shows the signs of rapid metabolism here. Signs of rapid metabolism and also loss of flesh with great appetite. So patients needs to continuously eat something. His metabolism is so fast that he even frequently want to eat something. So even though he eat, there is a loss of flesh, iodine. And the glands, majority of glands of the body are hypertrophied, and they are hard and nodular. Hypertrophied, hard and nodular. Patient is emaciated, and iodine patient is hot. Hot patient and he is better by cold. Hot patient better by cold. And patient wants to move all the time as the symptoms are relieved when she is busy. So patient is always hungry, wants to eat all the time, but also has indigestion. So the metabolism is very fast, but assimilation of the food is poor, and it is very low. So desires motion all the time. Coming to aggravation, it is warmth in general. Warm, he's a hot patient, so warmth in general, there is aggravation and exertion. Amelioration is by eating. Cold in general, by walking on or by any moment. Next we will deal about, this is all about the iodine. Next coming to phosphorus here. Phosphorus, again, it is also one of the essential remedies. Whenever you come to phosphorus, you'll be thinking about burning, right? Like arsenic, alb and all. So phosphorus is also very essential. So phosphorus, when it is indicated, when there is certain pelvic inflammatory disease, PID, if this infection is very chronic, such as like chronic salpingo ovaritis or chronic endometritis, which is usually tubercular in origin, or malignancy of genitourinary tract. So this is well treated by this remedy. The phosphorus is a very awesome remedy, and it is very peculiar remedy for this condition. Any malignancy of genitourinary tract, it is well treated by this remedy. Chronic endometritis, chronic salpingo-ovaritis. And next coming to dysfunctional uterine bleeding. DUB is an important cause of menorrhagia. This is the main cause, DUB. Okay. Next coming to PCOD. PCOD is the next main important cause. So polycystic ovarian disease. Polycystic ovarian disease may be seen developed if the patient has psychosis as a predominant miasm. PCOD I have explained about the previous classes, von Willebrand disease, and when I was explaining you about the puberty lectures, so I have explained you in that. Next coming to, there is something, a predominant miasm behind the patient, like a history. If it is a psychotic miasm, so this is a very much indicated remedy. Phosphorus, you have to give this remedy. Next year menses is too early and it is very scanty but lasts too long. The menses is early, it is very less, and it is long duration of time or period of time. Along with that, there is stitching pain and the bleeding is copious, dark red and non-coagulable. So there is burning and stitching pain in the region of uterus. Fibroids of uterus is again a very common point here to be mentioned. Ovaries are inflamed here and are painful at the time of menses. At the time of menses, ovaries become very inflamed and are painful. Next coming to fibroid uterus. So fibroids of uterus are common. Menorrhagia due to uterine polyp. So it is again a main cause. There is numbness, trembling and paralytic weakness of the extremities. So major joints of the body are inflamed and are stiff. So there is a PID, DUB, PCOD, all of these, fibroid uterus, all of this is phosphorus. Next coming to bronchitis and laryngitis. So bronchitis with bloody expectoration, laryngitis with hoarseness of voice, seen in phosphorus. Laryngitis with hoarseness of voice, bronchitis with bloody expectoration. There is sharp stitching pain in the chest, along with hemoptysis, blood sputum, along with presence of blood in the sputum. Morning diarrhea, stools are profuse, hemorrhoids with burning pain. Hemorrhoids with burning pain. Burning is very much peculiar to this phosphorus. Mentally, patient is very much excitable and has violent imaginations which prevents his sleep. Mentally, the patient is very much excitable and has very violent imagination which prevents the sleep. Patient is hypersensitive to external impressions. The patient is anxietic, irritable, fear mark the remedy here. Anxiety, irritability and fear mark the phosphorus remedy. Next, coming to the modalities of the patient. Aggravation, there is in the evening and on the left side, and cold. Next, coming to the amelioration, which is warmth in general, lying on right side. So this is all about the phosphorus. Aggravation, amelioration, some particulars of this phosphorus you have to write where they'll be asking it for 3 marks. Next, coming to the third remedy, which is Sabina. So Sabina is a great anti-hemorrhagic remedy here. So whenever you think of Sabina, it is very much essential in cases of hemorrhage. So they say it is a great anti-hemorrhagic remedy. Sabina acts upon the mucous membrane of the uterus. So Sabina, it acts on the mucous membrane of the uterus and also upon the serous and fibrous membranes. Both of these membranes are being, the action of this is both the membranes, actually the mucous membrane and the serous membranes of the uterus. It's coming to the pains which are here. They fly from sacrum to pubis. So the pain here, it flies from the sacrum to pubis. Hemorrhagia is profuse. Hemorrhage is profuse at the time of menses, the long lasting here. Partly fluid and partly clotted, which is offensive in smell. Offensive it is in nature. Blood comes out in gushes, it oozes out. There is intense colicky pain in abdomen. Blood gushes out. Next, coming to pains like that. Pains are associated, with bearing down. Intense colicky pains in abdomen. At the time of menses, these pains associated with bearing down, labor-like pains. So pains transverse from vagina to uterus. So discharge of blood between periods. Discharge of blood between the periods with sexual excitement. And next, coming to inflammation of the tubes. Inflammation of the tubes, ovaries and uterus. Inflammation of tubes, ovaries and uterus. Next, coming to uterine fibroids are usually the cause here. The cause of this bleeding, whenever the cause of this bleeding is related to fibroids, then Sabina, you should think of this. There is a severe blood color will be partly fluid and partly clotted, which is offensive in nature. Then you have to point definitely to this Sabina here. Next, coming to Sabina, patient has hemorrhagic tendency and bleeds from every mucous membranes. There is warts around anus. Aggravation of the patient is warmth in general, warm room, and everything is warm, and it is warm applications and hot food. It is all about the modalities, which is aggravation. Next, come into amelioration. Amelioration here is cold open air, cold drinks, cold applications. Everything is cold, and amelioration to everything which is hot. Aggravation is to warm, amelioration is to cold. Next, coming to the fourth remedy, which is Simusiphigia. So here Simisofugia, it is also known as Actia racemosa. Some people get think that these two are different remedies. The main point of this is due to prolapse of uterus. Simisofugia, which is again called as Actia racemosa, the main cause of this is prolapse of uterus. Menses here are profuse and too early. Sometimes it is twice a month. Sometimes here it is twice a month. And next, coming to there is bearing down and pressing pains. Sometimes the menses will be twice a month, and there is bearing down and pressing pains in the uterine region. This pain goes from hip to hip, and the blood is dark and it is coagulated. Severe pain in lower extremities. So the pain extends. The main Simisofugia's main action is pain, which is mainly on the nerves and the muscles, the capillaries in the muscles, where there is intense pain. So pains are the main here. Coming to severe pain in lower extremities. Next, coming to backache after menses. So here also backache. So it is related to pain with heavy pressing down sensation. Next, coming to discharges or very offensive spasms and cramps. Offensive discharges are very offensive, and next coming to spasms and cramps and muscles of back. Shooting and throbbing pains in the head as a reflex of uterine bleeding. Next, coming to ovarian neuralgia is well treated by this remedy. Pains across the pelvis, rheumatic pains. See here, everything is related to neuralgia, pains across the pelvis, and they're all about the rheumatic pains as well. So, rheumatic pains in joints, there is insomnia, sleeplessness. Okay. It's coming to the patient here, the mentals. Let's go to mentals. The patient here is depressed. There is visions of rat, very peculiar mice running across the room. So there is something hysterical and delirium, and there are some epileptic spasms here. And the mental symptoms are intermingled with rheumatism. Okay. This is very must in Simisofugia. You have to remember all of the hysterical conditions here. Next, coming to modalities of this year aggravation is menses, and in cold season, cold drinks is aggravation. Next, coming to amelioration here is warmth in general, and after menstrual flow. Okay, this is all about the Simisofugia. Next, coming to the fifth remedy, which is creosote. So in creosote, it is mainly the cause of this is endometrial polyp or abnormal growths of the uterine cavity. Endometrial polyp or abnormal growth of the uterine cavity. So this is the main fundamental cause of menorrhagia in creosote. So there is burning and soreness in external and internal parts. So this is the main cause. Okay. Next, coming to burning and soreness in external and internal parts. Burning and soreness. Menses here are too early, prolonged, and the flow is black and offensive. So the discharge is prolonged, so the discharges which are there excoriate the thighs. They excoriate the thighs. There is leukorrhea before menses, which is yellow, acrid, excoriating, and offensive. Next, coming to bleeding from uterine cavity is continuous in nature. Patient complains of pain in abdomen, especially before the menses. There is pain, burning and scratching sensation at vulval region and medial sides of thigh. There is sudden desire for urination. Patient is not in a position to hold the urine and she has to hurry for urination. So, hurry is for urination. At vulval region there will be an itching. Okay, and medial sides of thigh. There is urgency to urinate. There is fullness and burning pain in the stomach. Nausea ends in vomiting. So it is used for palliation of malignancy of genital organs. Used for palliation of malignancy of genital organs. All symptoms worse at the time of menses. So whenever menses comes, there is aggravation of all the symptoms, and think of creosote. So there is offensiveness of discharges, and also very offensive and very irritable during menses. Patient desires many things, but when it is offered, they reject it. So this is the main characteristic of this creosote. Let's go to modalities, which is cold in aggravation, cold air, washing parts. Amelioration is warmth in general and rest in the bed. So this is all about the modalities. Next, coming to the sixth remedy, which is the belladonna here. So first I'll explain the platina here. So platina menses here is the platina lady are much earlier, so they get menses very early, profuse and short, and the blood is very dark and clotted. So there are spasmodic pains here. So duration is very much long and strong. So it may be short or long. Okay, the blood is very dark and clotted. There are subtle pains like very bearing down, along with numbness of pelvic organ. She feels very chilly. The patient here feels very chilly, and there are spasmodic pains. Flow may appear every 14th day. Every 14th day, this lady gets pain. That is a platina remedy, and she is a chilly patient, of course. Okay, flow may appear every 14th day. She has tingling sensation in the parts. After menses, there is profuse leukorrhea. Very much peculiarity is leukorrhea, very profuse. So platina is known for hyperesthesia. Platina is known for hyperesthesia, which leads to vaginismus and nymphomania. Vaginismus and lymphomania. So the parts are very sensitive to touch and go into spasms on touch. Okay, here dryness of vagina will be there. Okay, and painful sex. Next, there is a cold key pain in abdomen. She cannot complete the coition due to vaginismus, dry vagina, painful vagina. Okay, this parts goes into spasms whenever it is touched. So weakness with chilliness and numbness in parts, headache with sense of constriction in the scalp, constipation even with soft stool. She is very hot patient, but the patient feels chilly, but she is very hot. So the aggravation is by rest on excitement and while sitting and standing. Amelioration comes to open air. Next, I'll be saying you the last remedy, but it is also very essential. Should not neglect any remedies whenever there. You have to first think of the cause and also the modalities before you give the remedy. So next is belladonna. Here in belladonna, so menses in case of belladonna increased and are premature in nature. Along with the menorrhagia here, she even complains of mastodenia. Okay, so the patient here even says she suffers from mastodenia. Okay, so the menses here are premature. So meaning of this is mastodenia is the pain in the breast, which is mastodenia, pain in breast, whether there is a tightness and tenderness or sharp pain in one or both the breasts. So the menses here are profuse and bright red in color, feeling as if everything would escape from the vagina. She feels like everything would escape from the vagina. So the belladonna patient is very chilly, and easily affected by draught of air. She has violent congestion in her body, so she feels very hot. She's drowsy and always sleepy, but cannot sleep due to cause there are pains, so she is unable to sleep. And she has very violent congestion in her body, so she feels hot. There's congestion in the body. Keynote of this belladonna is congestion. Okay, should not forget the congestion of the parts. There is tightness of parts and congestion of the breast. So there is heat, redness and burning is belladonna. So this is the main peculiarity. Congestion also included heat, redness and burning. Drowsy but not sleepy. She cannot sleep due to pains. Next, mentally, she has marked violence due to turmoil in her brain from congestion. Turmoil in brain or circulation is belladonna. Okay. There is great dryness. There is great dryness everywhere. So next aggravation is drought of air and also the heat of sun, moving about, which is a motion, and bending and lying down. So these are the aggravations the patient feels when whatever these things she do, she gets aggravated. And when she ameliorates is sitting in the erect position. Sitting in erect position ameliorates all of her complaints, and this is all about the belladonna. So these are the 7 main remedies which I've explained here about this menorrhagia. Please like, share, subscribe to my channel and stay tuned for more updates. And